Okay, everybody, welcome to this session. So for those of you, this is the data session on counting the invisible. If somebody wants to attend the learning session, an interactive session, it is in the back room, but hopefully those of you who are here are staying for the data session. So I hand over to Kjell Erik Ole, who is the National Director of Plan Norway, who will be guiding us through this session.
Okay, thank you. It's an honor to be here and to chair this important session of this very important conference. I'm, as Aiden said, the National Director of Plan International Norway. I've been with Plan since 2009, but I've also been a politician. And why am I saying that? That means I believe things change not by coincidence, but because someone wants it to change. Because someone worked for the change, because someone is committed. And I will introduce myself by telling one personal thing about myself. I have a 22-year... Am I close enough to the mic now? Okay. Old, mentally disabled son. A happy, healthy, handsome young man who had learned me how complicated things could be simplified. He grasped the essence of my sometimes complex reality. To me, life is sometimes overwhelming, depressing. To him, life is about trusting people, loving people, answering with questions when he doesn't understand without being embarrassed. And the idea of him being hidden, not being counted for, not being a part of the knowledge that makes us human beings is heartbreaking. So everything we do should be knowledge-based or about gaining new knowledge and new insight. And this session is about knowledge, about breaking that vicious circle, not being seen, not being counted, not being understood, not being included. As Aidan Levy said earlier today, we are here because we don't have all the answers. So you will, during this session, have the opportunity to listen, to ask questions, to discuss, and to vote. And the objective is to identify ways in which Plan International can strengthen tracking of data on girls and boys with disabilities to improve future policy and program development. And this can be done by learning from persisting gaps and challenges, promising initiatives, and data-related processes inside and outside of Plan. And we will hear examples and let us be challenged and inspired during this session. So, then the speakers. We have here with us today Marion Sight Savers, and Marion has been working within the disability field for more than 17 years, and she's going to talk about counting the invisible, the need for qualitative data. We have Alex Munivi, Global Girls' Rights Program Advisor in Plan International, one of my colleagues. He's going to talk about Plan International's SDGs Tracker Initiative. He's in Plan International, we call him the gender guy. And we have Mary Lagay, researcher within Plan International also. She's going to talk about disability and Plan International's sponsorship data. She has been supporting the coordination of Plan International 2013 study Include Us. And last but not least, Ashael Bush, Disability Inclusion Advisor, CBM Australia. He is going to talk about, collecting and using data on disability to inform inclusive development. He is a former colleague. He has previously worked for Plan International Australia, Plan International Cambodia, and several local NGOs in inclusive program design. So, before I hand over the floor to these excellent people, we will have a poll. And since you have already learned how to do this, hopefully someone is now handing out the devices. Yes? This is always the worst session. It's just after lunch. But just remember, it's very visible from here who is falling asleep. We can easily tell. So we are going to do the Umbia test once more, or not a test actually. We're going to use it. We're going to ask you questions. And the first question is actually linked to the lunch and what I just recently said. Okay, I will read out. How do you feel right now? A is not good, B is okay, C is great, and D is really fabulous. So how do you feel first session after lunch? So someone will probably tell me when we are ready. Are we ready to vote? We are ready? Okay, you can vote now, and somebody will probably also tell me when to tell you that it's over. Okay, go ahead, vote. So I don't know, we're not 100 anymore, so we can't wait for 100. Okay, so how do I stop this? Next. Okay, getting up, getting up. Okay, we stop there. Okay, so you feel you feel good or great, most of you. Three persons I feel sorry for. You are probably the three ones that's gonna fall asleep. So if it's more than three people falling asleep, I will kind of let you know. Okay, we have a second question, and this is a very concrete question with just one correct answer. Um, how many girls does Plan International aim to reach in its new global strategy? And you can vote now. Some of us have been discussing these figures a lot, yeah, can tell you. Okay, there are more people in the room, at least 61. Okay. Okay, some four people, they don't know. They don't want to guess. Okay, the majority knew it's 100 million. Congratulations. Then the third question, how relevant is disability data collection in your work today? A, not as much, B, some, and 3, or C, a lot. Start voting. Okay, stop voting. It gave up. I don't know. Go back. Okay, thanks. Good. We're going to repeat this question later on, but then we will not talk about today, but the future, and we can compare the results. So thank you very much. Now we will have these four excellent speakers, and I start by handing the floor over to Marion Steff, Counting the Invisible. The floor is yours.
Do you have my presentation? Here we go. Thank you. Hi, everyone. Can you hear me? Yes. So thank you, Plan, for having me today. My name is Marianne, and I work for Site Savers. The title of my presentation is Counting the Invisible, the Need for Qualitative Data. So I've done a little exercise quickly to get some fact within SDG 4, focusing on education. And I was trying to count the number of keywords within SDG 4. So, and you may have done the same exercise. So I looked, for instance, at inclusion, and that was mentioned once in the overall goal, which is actually a good thing. Disability was mentioned 4 times. Girls was mentioned twice. Women's was mentioned twice. And vulnerability was mentioned twice as well. So I think we get a very good message here from the UN, meaning that everyone has an equal right to quality inclusive education, no matter what their ethnic group, their age, their gender, disability, ethnic system, etc. So I think it's quite clear the UN wants to be ambitious, and we have 15 years to do so. So what's missing? And I actually give it away in my title, is actually qualitative data. It's not mentioned in SDG 4, it's not mentioned in any of the SDGs. But we have some good news here. The first one, for instance, is that the UN is very open to innovation and creativity when it comes to collecting data. They're looking for more information to support understanding and to really reach everyone on the planet. And the other thing that we need to remember is that data collection is going to be mainly a national exercise. So we have a chance to influence our governments to be creative and to collect qualitative data and quantitative data. So today I wanted to present a study we've done at Site Savers. You have you have behind me the picture of the report itself, which is called "Hear My Voice: All Age and Disability Are Not a Curse," and I've bought more copies if some people would like to take some. And it's the studies that we've done in collaboration with HelpAge, ADD International, as well as Ifakara Health Institute, which is a research institute based in Tanzania. And we also work with the Ministry of Tanzania, the government. So yes, the study was in Tanzania. We've done it in the past in Bangladesh. And the purpose of that study was to gather the voices of women and men with disability and older people to provide some qualitative input to inform Agenda 2030 and the SDGs. And I think what is original in that study is that we use as a methodology a community-based participatory research approach. So what it means concretely is that when it comes to data collection, we actually train people with disability and older people and staff from NGOs to collect stories in their communities or with staff, other NGO colleagues. So we trained 26 people who were in the field and collected 106 stories. They also work on the analysis of the stories themselves, and they came up with 8 priority themes for policy focus and advocacy efforts. So I have them written behind me. I'm just going to say them out loud. The first one is access to education and quality learning, which will not be surprising. Access to health services, issue feedback from NGOs, poverty related to income and independence, attitude towards witchcraft and albinism, something that's very important in Tanzania, relationship difficulties and marriage breakdowns, sexual violence and gender issues, and poor treatment from family. So today I'm going to present the findings related to education. So what they find in general might be something that you heard in the past or you're familiar with, is little investment from the government in supporting inclusive education. Teachers are not adequately trained to teach children with disability. School infrastructure are not accessible. The community does not engage in supporting access to education for children with disability. The family does not send the children with disability to school because of different reasons. So you have reasons like cost, reasons like illness, but also sometimes a lack of understanding about the importance of sending their children to school. And there's a free education policy in Tanzania to send children with disability to school, but it's not implemented, and parents have to pay school fees. So I've got some quotes from the stories that I'm going to read, so you're going to have an idea of what I'm a better idea of what I'm talking about. So the first quote I have is from someone who's 18 years old and who has a hearing impairment, and he was saying the following: "When I was discharged from the dispensary, I lost my hearing. I continued to stay with my aunt at home while using drugs prescribed at the hospital and felt better. When I came back from the hospital, I could not hear properly. I was bright, but I started to drop in the class. I left school because I could not hear what was being taught, so I saw no importance in school." The second quote I have is from someone who's 19 years old and is a person with albinism. "When I attended school, I was humiliated by teachers and decided to quit. I was the only person with albinism in the class. For example, the teacher would tell me that I had to sit at the front because I had a visual problem and could not see well, but in fact, I was already in the front seat and could not be closer." So I've got one more quote for you. It's someone who's blind, 25 years old. "When I was in primary school, I would tell the teacher that I could not see. I would ask, 'Can you please read for me?' But the teacher would say, 'Why do you come to school if you cannot see?' Besides, there were no user-friendly learning material." So I'm thinking it's probably stories that actually resonate in the daily work that you have. So the peer researcher in the study came up with way forwards to try to influence the Tanzanian government, and they are the following. So for instance, more teachers should be trained to provide quality inclusive education for learners with disabilities. Curriculum should be flexible and adapted to the needs of learners. Parents of children with disability should be sensitized to the importance of taking their children to school to receive an education. Community should be made aware of the importance of supporting families with a member having a disability. Curriculum should teach about the importance of respecting and for each other. And then you might recall that there was also older people in a study. So they were thinking that older people should be listened to. Their life experience is invaluable. So I'm gonna have some recommendation here. I'm gonna make, and I think it's really important to have also quality data when it comes to collecting data, because it really brings a deeper understandings of any issue in general. And that data obviously will be linked to human experience, and it's far more compelling and powerful than data gathered just only with quantitative research. Qualitative data reveals qualitative data reveal issues that could not be exposed with the sole use of quantitative data. And I think it's important to really realize it's not that qualitative data is better or than quantitative data. I think both need being used in combination, and they can be very much complementary. So it's important for us to really engage in advocating for the different use of data sources in the SDGs, for instance, quantitative data, perception data, and citizen-generated data. The reality is that within our organization, we do collect a lot of data as well, and it's important to bring back that data to our governments to trying to influence them when it comes to the SDGs. So that's going to be it for me. Thank you very much, and I'm available for question afterward. Thank you.
Okay, this works. Thanks, Marion. I left school because I couldn't hear a strong message to us all. Okay, Alex, the floor is yours.
Good afternoon, everybody. I'm not a politician, but I also believe in change, and that change is possible. I'm going to present to you a partnership and an initiative that we have been working with different organizations during the last year. A really exciting time for Plan and the partners. We built a civil society and private sector partnership to really fuel a movement that will push pressure to governments to fulfill the commitment that we have around the SDGs. So we have these organizations which are the founding partners, including civil society organizations, but also the private sector. As you all know, the civil society played an enormous role in the development of the SDGs. And now when these have been approved last year, it is time to implement them and monitor them. And as independent voices, the partners of this coalition will hold UN agencies to account, governments and other stakeholders, and we will be producing an independent data tracker. We will be advocating for increased use and availability of information and data so that decisions on policy are made based on evidence. And we will be working at the global, regional, and national level to advocate for change for girls and women in all their diversity. Let me share with you a little bit of what we are doing. So we have developed an indicator framework. Our coalition will be tracking the priority official indicators with a commentary. So we will be telling commentaries around the data that is being produced. And so far, we have selected 63 indicators within the framework of the SDGs across the 17 goals. And a fundamental aim of the tracker, following these indicators for the next 14 years, yes, we're already 1 year ahead, for the next 14 years, will be to explore the potential of disaggregation of data and to draw different insights into it so that we can have more granular understanding of what's happening with girls and women across the world around the implementation of the SDGs. For example, when one looks at issues of intimate partner violence, we will be looking at how using the household survey stratifiers, which includes disability, to get a more clear understanding of what's happening around domestic violence and intimate partner violence. The indicators and the whole tracker initiative will be able to give us a story of what's happening with girls and women during the next years. And we will be able to identify existing data gaps, as well as identify areas of research. For instance, where there's not enough disaggregation, where we cannot get the information that is required to get a full picture of the commitments around the SDGs. But we also acknowledge that, like the presentation before, that we need also to look at other ways of getting data. So we will be also amplifying the voices of the girls and producing qualitative research, particularly using perception-based data. I was just last year discussing with a group of girls around issues of safety in the city, and one of the things that we heard from them was that it's not only looking at the actual numbers of violence happening on the street, but actually how they perceive the sense of fear. So we're also aiming to complement the official indicators with this perception-based data that can help us give us a broader view around the implementation of the SDGs. In order to do this, we will be building relationships with a range of key institutions, agencies, and national governments to be able to track and get the data that we need for these initiatives. But we will not be afraid to be bold and to raise up our voices when necessary issues that matters. For instance, we're not funding this initiative by any money coming from any government. So this is an independent civil society voice that wants to be critical. We will play a role of an ally, but also an antagonist. At the same time, sharing knowledge, experiences, and resources. And finally, working with the decision makers across the globe at all levels to improve measurement and action on gender data. And as I said, one of the key initiatives is to really amplify the voices of girls and women using perception-based and qualitative data as well. But this is not only a partnership to work around influencing issues at the global and regional levels. We're also aiming to work at the national levels. And we're aiming to work very closely with the women's and the girls' rights movement to use the information and the data that we're receiving to change policies and make decision makers aware of how are we advancing or not with the SDGs. So we will be developing reports, also data visualizations, scorecards that can help in the communication and negotiations that we will be having with the governments and the decision makers around the implementation of the SDGs. Currently, we will be as a partnership, as the coalition, we will be working in 6 countries. The final list of countries will be finalized this month already, but this is the initial preliminary list. These countries were selected to reflect a high percentage of young people living in them, a high burden of gender-based rights violations, also where there was a space to do a lot of influence in advocacy in terms that the civil society had the space to really be engaged actively in doing advocacy, diversity in terms of the geographical coverage, different economic situations, but also populations. We go from India to Nicaragua with only, how many millions we have in Nicaragua? 5. Yes, 5 millions to the 1.3 billion in India, and to build as a partnership relationship with these countries. This will be expanded as funding, and the partnership will be growing to other countries as well. For instance, in Plan, we're working around influencing SDGs in 16 countries, parallel to this process as well. A really exciting initiative that brings the possibility of using data to influence decision makers and to building a world that is different based on a coalition that can have that critical voice, that can really influence the process, as we were successful during the last years. In terms of how disaggregated data is used, it's essential because we will not get the full picture if we don't understand the gender discrimination of different groups within the girls themselves as well. Thank you very much.
Thank you, Alex, and thanks for reminding us it's not only time to implement the SDGs, but also to monitoring them. So, Mary, the floor is yours.
Hi guys. Just trying to retrieve my presentation. Ooh. Okay, here we go. Nice to meet you all. I'm Mary. I'm a researcher from Plan's international headquarters. It's a real pleasure to be here, and I'm speaking today about our sponsorship dataset and disability. Before I go, can I just ask you guys to raise your hand if you've heard of Plan's sponsorship data? Okay, that's quite good. I'd say about half of you. Okay, great. Well, for the other half of you that haven't, I'll just briefly explain what it is and then go into the data we have on disability. Okay, so as we know, Plan operates a sponsorship model within our fundraising, which means we facilitate the sponsorship of children throughout the world. And part of that sponsorship process involves the collection of data on each sponsored child on a yearly basis. Now, the data is collected on aspects of their lives and living conditions, and it's used to update their sponsors in kind of annual communications and so on. The questionnaire is administered with sponsored children every year. It's a paper questionnaire conducted by frontline staff. The paper questionnaire is then uploaded to an online system called BI Online, where the data is available for analysis. Now, the database currently holds 6 years of data on 1.4 million sponsored children. So it's actually a huge data set. And a few years ago, I think 3 or 4 years ago, it came to the attention of the research team that this huge data set exists. And whilst its primary function is to collect data on sponsored children for sponsors, it's actually very valuable for research and evaluation purposes. So over the last few years, our team have been working with the sponsorship team to really improve the quality of the data, to make it accessible not only for sponsorship, but also for research. So we've been doing things like aligning the questions to national surveys like DHS and MIX so that they are comparable. We've also created a series of dashboards which are available for all plan staff to access. They can quickly look at the data on things like education, health, birth registration, and of course disability. So there's one question asked on disability in the sponsorship survey, which is this one: does the child have an impairment or a medical condition that can lead to disability? The answer to that question would be a yes or a no, and it would then be followed up with, if yes, what type of impairment? And the list of impairments have been matched against national surveys prepared by the WHO, so that our data is directly comparable with global surveys. And this data is, of course, available for all 1.4 million sponsored children, and the same question is asked of each child, so it is directly comparable between each child. Now, this particular data set is quite unique because, as we know, we heard this morning, there is a real lack of global data on disability. So in 2013, we decided to explore this data in a bit more depth and conduct a statistical analysis with the data. So the study was conducted with the London School of Hygiene and Tropical Medicine, and really it had two objectives. So it was to better understand the challenges faced by disabled sponsored children using the sponsorship data, but also to gauge the usefulness of the sponsorship data set. We've never actually used it for a robust statistical analysis before, so we wanted to see how it measured up. And the way the analysis worked is we compared children, sponsored children with a disability to children without a disability across a range of indicators. And the first finding that I've drawn out is that the study revealed that, on average, only 1% of sponsored children report to have a disability. This kind of number was actually quite shocking for us and has sparked quite a lot of discussions about what this says about inclusion within planned sponsorship operations, because we know that in the general population there's a lot more children than 1%. Okay, a few more of the key findings from the study. So these are the overarching findings. I've got a few copies of the report with me, so if any of you want a copy of that afterwards, I'll give one out. But really, the key findings were that sponsorship with disabilities were substantially less likely to attend school than children without disabilities. When sponsored children with a disability did attend school, their level of schooling was significantly lower than that of their peers. And in relation to health, sponsored children with a disability were more likely to have had a serious health illness within the last 12 months. This included malnutrition. So these findings perhaps aren't particularly surprising to us. I think all of us in this room are acutely aware of the disadvantages faced by disabled children. But the interesting thing here is that these children are sponsored children, and I think the findings were a bit of a wake-up call for Plan International to think about how inclusive our programming is in relation to education especially. A few additional findings just to draw on quickly, I'm aware I'm running out of time. But within most countries, inclusion levels for children with disabilities in schooling were highest for those with vision or hearing impairments and lowest for those with learning or communication impairments. So I think what this indicates is that the type of impairment a child has can be linked to the level of exclusion they face. So very quickly, just a few implications from this study that was conducted in 2013. Programmatically, the findings show that more efforts are needed to promote the inclusion of sponsored children in education and improve their health. It also demonstrated that the sponsorship dataset is a valuable dataset for us to use. The London School of Hygiene and Tropical Medicine were very impressed with it. So that was great news for us because we weren't sure how the dataset would fare for a statistical analysis. And finally, the study concluded that further research was needed to determine why children with disabilities face exclusion. And in relation to that last point, what we needed really was a qualitative study. So this quantitative analysis was able to show us the broad trends related to sponsored children with a disability. But as Marian's pointed out, a qualitative analysis allows us to go a lot deeper and really understand the lived experiences of children to understand why and how they experience exclusion. So just very quickly, we did do a follow-up study in 2015, which examined why sponsored children don't attend school as frequently as other children. Nepal was chosen as a case study for this analysis, and we conducted fieldwork with 21 families in 3 districts. Now, the tools that were used for this study are available, and we intentionally designed them so that they would be replicable in other contexts. So we do hope that other people will draw on the tools and maybe do similar studies in other countries within Plan. So very quickly, just the kind of key findings from the qualitative analysis, looking at the barriers to education for sponsored children. There's a whole list of them here, just to draw out a few of them. We had attitudes of caregivers and teachers towards whether disabled children can attend school. The ease of transportation to and from school. Economic factors, so the costs of parents not working in order to bring their children to school. Poor health and need for treatment and rehabilitation. Behaviour problems, so children being asked to leave from school during lessons. And finally, violence and discrimination from peers and teachers, not only in school but also within the community. Some of the findings from the study are really quite harrowing as to what a lot of the children are facing. Okay, so finally then, I've just included a quick slide on what next. Obviously, we've got quite a body of knowledge now in relation to sponsored children and disabilities. And one of the key things that's happening at the moment is we've had the launch of the new strategy. And with that has come a process of modernisation for sponsorship. And so a recommendation has been made that Plan should review the selection criteria for sponsored children, particularly in relation to sponsored children with disabilities. There are issues to consider within doing this, so whether Plan has the infrastructure to facilitate enrolling more children with a disability into sponsorship, staff training to make sure that when we are speaking with these kids, we're doing so properly, and adaptations to our current fundraising model. It's kind of a big issue to look into, but it's going to be looked at within this modernisation process. Finally, increased collaboration with our programmes and sponsorship team. So our sponsorship staff are interacting with disabled sponsored children. So it's really looking about how those interactions are taking place and how we can make them as valuable as possible. And finally, the possibility of a future study using the sponsorship data We have the capacity to do a longitudinal research study whereby we could track children over time because we have 6 years worth of data in the data set. So this is something we're looking to for the future. Okay, I'll stop there. I ran out of time quite a while ago. I've included in the presentation a list of useful resources, which includes links to both the pieces of research, as well as to the BI online database, which all of our plan staff can access. You can look at data according to your country, and you can actually drill down and disaggregate it according to the various indicators that we have. Thank you.
Thank you, Mary. You have showed us that there are existing data, but you have also given us evidence that our own way of working has excluded children. And you're right, it was a wake-up call for many of us. I am now, before I give the floor to you, we will show a short video called Invisible Girls, Gloria. It comes from Counting the Invisible report. So if you guys are ready, can we get the video?
Appiakle kawam na hapanis ke takimone mai ai ke kan mana lu ko den kle kabawa
Baka tuan tem yang bahana ni tur kawalde te mutlara yang sari kumai tau kan lesbe yang wal kan kakaba ko takapia kan yang witin watch kataki kapare silbi bichir pilu pia kumba ko witin watch kataki kapare yang ani rasi takwal hani rasi takau na katasin wel yang isti plapi balika witin ay responsable karabria ya ser karami kay kramupla wala ra witin yaban tem bahana ni takan baka tuan tem yang kupi kumbaywan an clear mismo tiempo en sari sina itaw kan
kunen kale kai karhen na ten kasin prira to pe na ra blek ri balan ba ko tan wala dia do kon
in our community, girls don't have autonomy over the body. The society feel like girls' body is free. So even though with disability, even though in the condition that you are, but if you are a woman, then anyone can take your body and use it the way they want. Indigenous girls face triple violence through their condition, through their situation, and through the area where we are located.
ba ko kan men sar pentere ya el pemem la ding de ka wan na kone yang kai kara na kai kam na ka ke kam na kona ni nu de ka sa kola ni na bale ka ta pen no
Thank you. Now, Ashel, the floor is yours.
Wow, that video is a bit of a tough act to follow, especially when you're talking about the exciting topic of data. Sorry about that. Okay, so my name's Aisel. I'm from CBM Australia, and I also used to work for Plan Australia, so I'm familiar with wearing different hats, the blue one as well as the other coloured ones. And I'm here today just to talk about, mostly about this one document. Yep. So this is a document which Plan International Australia partnered together with CBM Australia and the Nossal Institute for Global Health in Melbourne. And it's really it's not a how-to manual, but it's a bit of a guidance and a discussion document around how could you approach disability-inclusive data collection at the program level in community-based programs. We decided to put this document together for a few reasons. Partly, there's a lot of pressure on everyone to collect disability disaggregated data or to be reporting to donors who are requesting data. There's also just a lot of interest in disability with the SDGs. So we found that a lot of practitioners were asking for guidance, or if not that, they were sort of tempted to run ahead and use various data collection approaches. So we wanted to invite people to sort of step back a little bit and reflect on what is it that you're trying to do and how could you do that in the best possible way. So that's what this document is, not a how-to manual. I'm going to go briefly through some of the key messages from this document, but I'm not going to go into any real detail now because we are having a longer session tomorrow afternoon. So if you are interested, please do come along. Basically, what am I talking about? So you've heard a bit about data collection. In my mind, data collection in terms of programming is two main things. Firstly, there's monitoring and evaluating of disability inclusion outcomes from development practice. But disability inclusive data collection, or M&E, is also about using disability inclusive and accessible processes and methods and tools for all data collection and M&E processes. And as you've heard from some of the other examples, it's also about research and advocacy and policy influence work relating to the situations and experiences of women and men, girls and boys with disabilities. So that's what I'm talking about. I'm going to launch straight into just a few key messages and a few questions to try to get you thinking about things. First one. So the first message is to think about why you're actually collecting data. So we found that a lot of people were running ahead and sort of just racing to keep track with requests to report and to disaggregate. So we wanted to think, why are you actually doing it? So don't just do it for reporting. Make sure that the information you collect is useful and relevant to the types of change that you're trying to bring along, and also is actually used. So don't just report on it and file it away in a filing cabinet. And if you're really just collecting data for compliance, well, it's a bit of a shame, but hopefully we can push back against the people who are requesting that from us and make sure that what we're collecting is really useful and relevant. It's also about thinking a little bit about what's Plan's role. So is Plan a primary data collector, or is Plan's role to influence and advocate for others to be collecting disability disaggregated data, or to be doing qualitative research and collecting and enabling the voices of people with disabilities to be shared? So really what this is about is integrating disability inclusion throughout all of our M&E processes. It needs to be in indicators, M&E frameworks, it needs to be written up as outcomes, we need to be specifying or requiring our consultants and evaluators to include that in their terms of reference. So the next point is about adapting processes and methods. So process is important. It's not just about what you collect, it's about how you collect it. So the message here is take a bit of time to think about how you could make your M&E data collection processes and methods accessible, inclusive, and empowering. So the key message here is about engaging people with disabilities in the process. They are the experts on disability, and it's not just about engaging them as as informants or subjects of research, but really about involving people as collaborators, advisors, and supporters of the process. And the other reason to make your processes inclusive is that we've seen that in many organisations, actually having inclusive M&E processes can be, often it's the first step that an organisation makes to actually trying to promote disability inclusion, so it can be a real entry point. So it's not too late if you have a program that hasn't really considered disability inclusion. It's not too late to start doing some reflection, some data collection, some analysis, and providing recommendations and lessons learned for the future. The third key message is don't just count, learn. So we've already heard from some of our colleagues this afternoon about the importance of having both qualitative and quantitative data. So really what's needed, I know there's a tendency to feel the need to count the number of people who are participating or are benefiting from a program, and that's totally valid, but also think about how you could measure levels of participation or the quality of participation, how you could assess and identify barriers to inclusion, how you could measure equality of outcomes between girls and boys with disabilities and those without. And the final key message is that there's no one correct message, correct method or tool. There are many, many different approaches. Sometimes it's just about adapting our existing methods and tools. Sometimes it's about using specific tools that have been developed for collecting information relating to disability. So there's a lot out there. And the one key message that I wanted to mention about that is don't just ask if someone has a disability. There's a whole lot of reasons why you shouldn't. Typically, if you ask that question, you'll get a significant underreporting of the real level of disability that exists in a community, which we know is roughly around 15% globally. There's also a whole lot of ethical reasons why you wouldn't want to do that, related to causing shame, stigma, or not giving someone the independent choice to actually choose whether they want to self-identify as having a disability. So those are the key messages that are covered in this document. We'll be going through them in more detail and doing some practical thinking and talking about what that might look like in practice.